Poor women in the Philippines get pregnant more often than they want to. Filipino lawmakers are trying to give them more options, but they face a tough fight. Rosalina had her first baby at 16 and bore 5 more before she ever thought about family planning.
Mariela and Crisanto Jr.
Today, Rosalina takes the pill to avoid another pregnancy. She is in an alternative learning program and hopes it will lead to a high school diploma, a job, and a way out of poverty. It is hard for us to manage. Sometimes we run out of rice. There are times when I don't eat. I give my share to my children and to my husband who is working. Rosalina is lucky to live in a town that makes family planning readily available to the poor. Most towns do not. A bill now before the Philippines Congress would require the national government to distribute contraceptives to local health authorities. The current policy promotes only so-called natural family planning methods approved by the Catholic Church and not more reliable modern contraceptives. We use the rhythm method, but it doesn't work when my husband gets drunk. That's why we have many children. With so many mouths to feed, Rosalina and her husband Crisanto lead a precarious existence. One experience helped convince them to start practicing family planning.
My
5th child got pneumonia at 1 month old when my husband had no job. We had to borrow to take her to the hospital. We still owe 4,000 pesos.
When the baby got sick, I had to sell my shoes to pay for her medicine. From then on, I realized I should take more responsibility for my family.
Last year, almost 2 million Filipinas got pregnant unintentionally, more than half of all pregnancies. This fuels rapid population growth, perpetuating poverty and straining natural resources. It also has serious health consequences. Every day, 11 women die due to unsafe abortions or the lack of skilled care during childbirth. Family planning could reduce those deaths by 1/3, notes Dr. Junis Melgar of the Lican Center for Women's Health.
If you can help women prevent pregnancies, then they won't be exposed to the risk of pregnancy that kill them.
Besides promoting family planning, the draft reproductive health bill would increase access to skilled birth attendants and emergency obstetric care. All these steps are critical, says women's health advocate Elizabeth Angshoko.
More than 4,500 women dying yearly is no joke. This is murder of our women, and we must stop this.
Representative Edsel Lagman is the bill's author. He is confident despite the church's strong opposition.
In surveys after surveys, Filipino public indicated that they are favorable to the enactment of the reproductive health bill, that they are in favor of family planning, and that they are in favor of government spending money for family planning, including contraceptives.
Supporters say the measure would enable couples to delay pregnancy and choose smaller families, giving women more options than Rosalina had. I always tell my daughters not to marry early like I did. Look at us now. There are so many of us, and life is so hard. This report was prepared by William A. Ryan and Mark Westhoff and narrated by Cindy Bishop.